Doctors and nurses, what's your most jaw-dropping "why didn't you come in sooner" moments? Story 1. I am a medical physicist, and about 12 years ago, I was asked to review a case involving a woman with a very slow-growing tumor on her nose, a basal cell carcinoma. Usually, this isn't much of an issue. If caught early, it can be removed with surgery or treated with a short course of radiotherapy. However, this woman was quite vain. As soon as the lump started growing, she hid it under a scarf. She ended up hiding it for 20 years. By the time she saw a medical professional, the tumor had taken over most of her nasal cavity, crushed one eye, deformed her entire face, and grown between nerves and blood vessels. It was inoperable, and radiotherapy posed a high risk of damaging surrounding tissues. Such a shame. It would have been so easy to treat 20 years earlier. Before we continue, do us a quick favor, smash that like button and subscribe to support our channel. Story 2. This one's from my sister-in-law, who's a nurse. A young man was brought into the emergency room with a sinus infection he had ignored for months. It had progressed to the point where the infection had eaten through his skull and reached his brain. She was told the symptoms had started several months earlier, but he had refused to see a doctor. All it would have taken was 10 days of antibiotic pills. Instead, he wasn't brought in until he was unconscious, and he passed away within a few hours. I read medical records for a living, and came across a case where a young man kept coming in complaining of frontal headaches. His doctors tried all the usual migraine treatments, but nothing worked. Then he developed a constant runny nose. Eventually, they realized it was cerebrospinal fluid. A CT scan of his brain came back normal. Finally, someone ordered imaging of his sinuses. That's when they found packing material in his left sinus, left behind from a sinus surgery over a year earlier. It had rotted and eaten through some surrounding structure. Story 3. I had a patient come in saying he couldn't see, and it had been going on for 5 days. The man had been blind for 5 days and didn't come in sooner because he thought it might be like a cold or something. During the exam, I asked him to move his legs, and he said, "Oh, I can do that." I asked how long he'd been unable to walk or move them. His wife chimed in and said it had been about 2 years. He had never seen a doctor about it. They just borrowed a friend's wheelchair and kept it rolling. Turns out he'd had multiple strokes with several risk factors he had never addressed. Given how little insight he seemed to have into his condition, I honestly felt sorry for him. He didn't have insurance, so I am sure that played a part in him avoiding medical care. Story 4. When I was in massage school, we offered low-cost massages to complete our required practice hours, which meant we worked with people from all walks of life. One day, I had a client who had a strong odor during the intake, but when I pulled back the sheets to begin working on their feet, the smell hit me like a wall. Still, I pushed forward and started with an initial stretch, then applied pressure to the feet, and that's when I saw it. Worms or maggots began to emerge from between the toes and the pads of their feet. It was horrifying. I immediately ended the massage per protocol and out of compassion and called over an instructor. We brought the client into a private room to talk about the health concern. I gently urged them to go to the emergency room, but they were deeply offended. They believed we were mocking them, particularly because of their weight. They said, "You're just saying that because you know I can see my feet. You just didn't want to touch me." It broke my heart. I offered to drive them to the hospital myself, pleaded with them to get help, but they left and never came back. I still think about them. I hope that after the initial hurt passed, they realized we were truly concerned and got the medical care they needed. I really hope their feet and their life were saved. Story 5. Just this Monday, a woman came in after being discharged from the hospital the previous Friday following childbirth. We always tell new moms to avoid physical intimacy until their doctor clears them, but her partner kept insisting, and on Friday night, she gave in. He ended up tearing some stitches, and she bled heavily all weekend. When she came to our clinic, her lips and fingers were blue, and her hemoglobin was 4 way below the normal 12 to 15. She didn't want to be a bother and waited until she was constantly dizzy. She had to go back to the hospital for a blood transfusion and repair. Like I said, this isn't the first time I've seen this. So for the love of God, if your partner is begging for it after you just had a baby, maybe he needs a lesson in self-control and a bottle of moisturizer. Another woman had a hysterectomy a couple of months ago. I warned her that if she had physical intimacy too soon, she could pop the stitches and her bowel could fall out through her front. Needless to say, she wasn't in the mood after hearing that. Story 6. My grandpa passed away because he waited too long to go to the hospital. This was about 17 years ago. He was tending to one of his mules when something spooked it, and it kicked him in the stomach. He was in a lot of pain and could barely move due to the abdominal pain, so he decided to take it easy and rest on the couch for a week. He refused to be taken to the hospital. What we didn't know at the time was that the mule's kick had ruptured a tumor in his intestines, one he didn't even know he had. The doctor later said it was huge, like volleyball size huge, and that he might have survived if he'd come in sooner. By the time we finally got him to the hospital, the infection had progressed to severe gangrene. His leg had to be amputated within a day of arriving. He passed away a week later. Story 7. I work in orthopedics, and one thing we see all the time is patients being told to follow up within the week, only to have them call on day 6 saying, "I broke something and need to be seen tomorrow." It's frustrating because we almost never have next day availability. If they had just called the day they were told or even the day after, we absolutely could have fit them in. One patient broke their forearm and didn't follow up for 2 months. We finally got them scheduled, they no-showed. We rescheduled, another no-show. On the second reschedule, they finally showed up, and their arm had an obvious deformity because the fracture had healed incorrectly. If they had just come in earlier, it would have been an easy fix. It blows my mind how someone can go nearly 3 months without any care. My dad was a doctor, which is relevant to this next part. Back in high school, I played basketball. During practice one day, I went up for a layup, got knocked by a teammate mid-air, and slammed into the wall under the baseline. My hand hit awkwardly, and it hurt a lot. I finished practice, barely able to put any pressure on the ball. When I got home, I asked my dad, who's a doctor, to take a look, because it felt like more than just a typical hand sprain. He ran me through a quick exam and said, if it were broken, you wouldn't be able to handle this without screaming. So no problem, just a nasty sprain. I practiced and played for the next 2 weeks, still in pain. After one game, I told my mom on the drive home that something felt really wrong and I needed to see a doctor. One X-ray later, and it turned out I had fractured my hand. I'd been playing for 2 full weeks with a broken hand. They put a cast on it, and just like that, my season was over. But it didn't stop there. Because I kept playing on the injury, I ended up pinching and cutting off blood flow to a vein in the neighboring finger. 6 months later, when I was still in pain, we saw a surgeon, and I was diagnosed with avascular necrosis in the knuckle joint. I had to have the dead bone scraped out and new bone grafted in to save the finger. That also meant no more football. The weakened joint could be crushed too easily, and if that happened, I'd lose the finger entirely. I had been a starter on every squad at school, but my hand was too damaged to keep playing. I was able to keep playing basketball for a while, but I eventually stopped that too. I just couldn't shoot the same way again. Story 8. My brother is an EMT at a warehouse. Recently, a guy came to his station saying something was wrong with his toe. My brother asked him to take off his shoe, which he did. He was about to ask him to remove the bandage around his big toe until he realized it wasn't a bandage, it was his skin. Apparently, the guy had dropped a 20-pound toad on his toe about a week earlier, but kept showing up to work anyway. They sent him to a doctor, who immediately sent him to the emergency room. The diagnosis came back as a tissue infection and osteomyelitis, a bone infection. The guy returned from the ER and said he didn't want to go through the ER doctor and would rather use his own insurance. My brother explained as clearly as he could that, as things stood, he was already likely to lose the toe, and if he waited much longer, he could end up losing the entire leg. I don't know what happened after that. I just hope he got the point. Story 9. I was that patient. When I was 18, I went to the ER for chest pain, and it was the most painful thing I had ever experienced. I genuinely felt like the guy from Alien. A few hours later, the ER doctor discharged me, saying it was just acid reflux and that I'd be fine. But over the next 2 years, the same thing kept happening. Once every month, like clockwork. On the first Saturday night of every month, I would get hit with the same intense chest pain. Nothing helped. I tried everything, over-the-counter and prescription antacids, not eating that day, drinking milk, sitting straight up all night. Nothing made a difference. Eventually, I passed out from the pain right in front of my mom. That finally convinced her and me to see a doctor again. On a hunch, the doctor ordered a gallbladder ultrasound. Turns out, my gallbladder was packed with well over 100 stones. Cue emergency surgery, a stunned surgeon, and a doctor who couldn't believe I'd been regularly passing gallstones for 2 full years. I faced something similar. I remember being in pain for years. Ever since I was 16, I had stomach pain that felt like someone was gripping my insides tightly. My doctor kept accusing me of faking symptoms just to get pain medication, even though I've never taken pain meds in my life. My stomach pains felt like period cramps, gas, or afterbirth contractions. At age 21, I went to the ER in severe pain, and they did an ultrasound. They found tons of stones, including one stuck in my bile duct. The technician asked why it took so long to get checked. I told her I tried, but my doctor refused to believe me because he thought I was faking. That doctor no longer practices medicine. Story 10. I had just started my first job out of college at the ER in my local hospital. The first week was the usual stitches, broken bones, the typical cases. Then, during my second week, around midnight, a very obese woman came in complaining of chest pain. We rushed her back, took her vitals, did an EKG and blood work. Everything came back normal, but she kept complaining of pain. My supervisor and I decided to do a head-to-toe exam. When she arrived, she had a strong smell, but I tried not to judge. People around here aren't known for their cleanliness. While examining her chest, I noticed her left chesticle was red and swollen. I told her I needed to lift it to check for any skin infections. The moment I lifted it, a wave of noxious odor hit me. Thank goodness for face masks. As I lifted her chesticle even more, I saw what looked like a mass of rotting tissue extending into her chest. My supervisor immediately ran out of the exam room and vomited in the nearest trash can. I asked the woman why she hadn't come in sooner, since it looked like a severe skin infection was raging under her left chesticle. She said she didn't have insurance and didn't think it was a big deal. I called in a few nurses and the doctor to help clean the wound. While cleaning, one nurse noticed some fur and bone. As we looked closer, we discovered it was a small animal of some kind. They collected the sample and sent it to pathology. After removing the animal, we saw that it had rotted so far into her chest that her ribs were visible. It turned out to be her missing kitten. She ended up spending 4 months in the hospital due to massive sepsis and related complications. Story 11. I am that person. Though I am embarrassed to admit it, my daughter's teeth were rotting because of a heart condition. We had to save for months to afford surgery to extract the teeth. We live in the US, and the surgery was considered optional, not covered by insurance, so it cost nearly $7,000. When they brought the extracted teeth to us, they were so rotten you could see the roots. I cried thinking about how painful it must have been for her to eat. We always brushed her teeth, but a combination of antibiotics and pain medications from an early age left her teeth basically mush. It was incredibly embarrassing, and we had to explain to the doctor and dentist that we knew but simply couldn't afford it. They just looked at us like we were terrible parents. Story 12. A man came to my clinic complaining of a swollen finger. His finger had been painful and swollen for about a week, and 3 days before his visit, a hole appeared at the tip. On the day of his appointment, he mentioned, "By the way, I pulled something out of the hole in my finger yesterday with tweezers, but I have no idea what it is." I asked if he had taken a picture or kept it, and he pulled out a tissue from his shirt pocket. Inside was his distal phalanx, the last bone in his finger. The bone had become infected, and his body was basically trying to eject it like a foreign object. In other words, he had pulled the tip of his finger out of his own finger. That's a magic trick I haven't seen since. Story 13. For 6 months in 2014, I kept telling my family doctor that it felt like I'd swallowed a Super Ball that got stuck, and that walking to the mailbox and back left me so short of breath I needed a 10-minute break to recover. I was also coughing up blood on and off. My doctor grew annoyed with my complaints and kept prescribing steroids. He told me that because I was overweight and a smoker, I needed to accept that I had COPD, and that this was going to be my life from then on. I finally said, "Look, send me for whatever test can look that far down my throat, and if it shows nothing, I will stop complaining." 3 weeks later, I had a sonogram, and they asked me to stay for another test. Then things escalated quickly. They said I had to go from the testing facility to the ER by ambulance. That hospital refused to see me, so they sent me to another one, and that one refused as well. We still had no idea what was going on. Eventually, I was taken to my current hospital, where they told me I needed emergency surgery to remove a cancerous tumor growing inside my airway. I only had 4 millimeters, about as thick as a coffee stirrer, left to breathe through. If I hadn't made that deal to get tested and accepted that not breathing was my new normal, I would have lived only another week or two. My family found a new doctor. In April of 2015, I was diagnosed with terminal stage 4 cancer in my throat, lungs, and spine. I am losing my fight and started home hospice 2 weeks ago. I put up a good fight, and I am so thankful I didn't pass away back in 2014. Story 14. I once worked in a dermatology and rheumatology ward. The patients didn't wait long once admitted, but they came from a nursing home. One patient had been admitted the night before I started, with a bed sore on their sacrum so large you could fit your fist inside without touching the sides. I am talking up to the wrist. They also had bed sores on their hips, heels, and shoulders. We had to order a special, almost sci-fi-looking hoverbed to help. The patient was in so much pain they had to be sedated at all times. It was a nightmare trying to treat them, but eventually we got the wounds down to a minimal level and discharged them back to the nursing home. Within a month, the patient was back, and the wounds were worse than before. Sadly, she passed away in the hospital. If she had been cared for properly or admitted earlier, she might have lived. Story 15. I am a children's nurse, and during my first week in the pediatric emergency department, a young girl around 6 or 7 years old came in with a severely swollen jaw and face. The poor girl couldn't move her jaw without intense pain and hadn't eaten for several days. It turned out she had only just started brushing her teeth for the first time ever, and in the process developed several abscesses and rotten teeth. To make matters worse, her mom told us she was recovering from the same procedures, having most of her teeth removed for almost the same reasons. They hadn't wanted to bother the doctor because they thought the girl was just pretending to get out of school. Story 16. I once had an older woman call in asking for a prescription for pain medication because she was convinced she had shingles. She said her neighbor had it, and she was sure that's what she had. She hadn't been seen by a doctor in almost 2 years, so the doctor asked her to come in for an evaluation before any prescription could be given. She refused and called again the next day asking for the medication. This went on all week. She kept calling for pain meds, and the doctor kept asking her to come in. She finally agreed to make an appointment. It turned out she didn't have shingles at all. It was a skin ulceration caused by advanced breast cancer. Story 17. My dad was the one who wouldn't go in. He got a sore in the crease at the bottom of his second toe and just kept ignoring it. He would go with his wife to her nail salon to get his toenails trimmed, and I think that's probably where the infection got in when they soaked his feet. He blew it off for a couple of weeks until his wife made him see a doctor. Luckily, she did. The infection had reached the bone, so they had to amputate his toe up to the first knuckle to stop it from spreading further. The doctor said that if he had waited any longer, he could have lost the entire foot. He's lucky to have just a stubby piggy and not a stubby leg. Story 18. I've seen a few cases over the years that fall into 2 categories. If it's not diagnosed, then I can have it, or I didn't think it was that bad. As a medical student, I remember an older woman whose chesticle was necrotic and literally falling off. This had been progressing over several years, but because she hadn't been diagnosed with breast cancer, she couldn't believe she had it. In the other category, I've seen several cases of Fournier's gangrene, mostly obese, male diabetics who started with a small sore or pimple in the pubic area. By the time they arrived at the hospital, it was a severe infection requiring surgery to remove all infected tissue in the pubic and groin regions down to the muscle. I lost an elderly friend to this mindset many years ago, despite 6 of her 7 siblings dying from some form of reproductive or genital cancer. She never had a smear test and ignored pain starting in her womb area that spread to her lower back. She told us she just had sciatica. It wasn't until the cervical cancer was literally growing out of her that she admitted something was wrong. After the diagnosis, she gave up completely, refused to eat, and passed away within weeks. She was an exceptionally stubborn woman. My mother-in-law was the same. She had a mass on her breast the size of a large piece of fruit that was eroding through the skin. She told everyone the pain was just arthritis in her shoulder. It wasn't until my sister-in-law insisted she get checked that she finally admitted how bad it was. Her GP sent her immediately to the ER, where she was admitted quickly. She was given Dilucidode because of the severe pain. It was stage 4 metastatic cancer. Miraculously, she lived another 18 months at the age of 70. Her excuse was that after losing her own mother to ovarian cancer when she was 19, she believed cancer treatment hadn't improved in 50 years. A coworker of mine struggled for months with eating and indigestion. Then she started vomiting everything for a week. Another coworker convinced her to go to the ER, and I went with her. It turned out her intestine was twisted and she needed emergency surgery. She waited so long because her mom died due to a malpractice incident when she was a teen, and now she doesn't trust doctors. Story 19. I was working as a surgical junior when my team was called to A&E to see a patient with complications from a recent hernia operation. When we arrived, the patient was holding a plastic bag over their abdomen. When we removed it, we saw that the wound had opened, and their intestine was exposed to the air. This hadn't happened overnight. It had developed over several days. The patient had started using plastic bags and newspaper to dress the wound after running out of proper dressings. I want to stress that this case was extremely rare and shows what can happen when someone doesn't seek medical care when it's clearly needed. Hernia operations are usually very common and very safe. Still, if you have any surgical procedure and aren't sure the wound is healing properly, you must see a doctor. Story 20. I worked as a doctor's office assistant. A regular patient who was very sweet but struggling with alcoholism was brought in by his roommate. I knew right away he wouldn't last long. I'd seen jaundiced patients before, but this man was a yellow. I'd never thought possible. His roommate, through tears, said, "I've been telling him to come in for weeks," but the patient kept telling him to relax, that he was fine. He was majorly in denial. I helped him to the exam room, and when the doctor came in, he immediately asked me to call an ambulance. A few weeks earlier might not have saved him, but maybe his end could have been easier. He passed away 7 days later in the hospital. It hit me hard because I'd known him for years. Sometimes he was sober when he called. Other times he was slurring and incoherent, but he was always kind. Something has to change about the culture around drinking. If you ever wonder if someone might be saying things like this about you someday, talk to someone, an unbiased friend or family member. Be honest with your doctor. And if anyone says they want to quit drinking, be supportive. Story 21. I am a doctor, and while working in A&E, we had an older man, probably in his 70s, who several days before coming in, suddenly had severe chest pain and vomiting while loading the car with shopping. He ignored it and struggled home. The next day, he started losing use of both legs. By the time he arrived at the hospital, he had been crawling around his house for several days, hoping it would get better. He had suffered a major cardiac event that caused a clot, which his heart pumped out. The clot traveled down his body, broke in half, and blocked blood flow to both legs. His legs were literally dead. I don't know what happened to him after, but there was no way to save the legs. I imagine the outcome was very poor, if not fatal. Story 22. I was sitting in a hostel with an emergency nurse and an emergency doctor who had just realized that although they worked on different continents, they did very similar jobs. We were chatting happily when an older man walked in. Hearing we were in the medical field, he came over to ask a question. He showed them his leg, which had large black spots all over below the knee. Both the nurse and doctor immediately said, "You need to see emergency services. That leg is necrotic. You'll lose the leg, maybe even your life if you don't." The man replied, That's what my doctor back home said too, but the leg feels fine. I'd know if it was dying." "You're wrong. Besides, I am not going to ruin my vacation by seeking medical treatment." That left me wondering why he even asked. He went to sit at the bar, and throughout the evening, the nurse and doctor tried several times to convince him that he might not have 10 days until he got home, that he needed treatment now, but they weren't successful. I am pretty sure if he ever made it to a hospital, the staff would be asking themselves that same question. Story 23. In my sophomore year of college, I started drinking coffee. Like most college students, I drank a lot of it. One evening during midterms week, I had a bad headache. I drank some coffee and settled into work for a few hours. The headache went away, but then I started feeling tingling and numbness on the right side of my body. It got so bad I could feel a clear line down my face where the tingling stopped. My whole right side was totally numb. I thought, it's midterms week, I probably just need to sleep it off. So I went to bed and woke up at 8 in the morning, only to find the numbness worse. Finally, I asked a friend to drive me to the ER. The doctor was horrified that I'd ignored such an obvious sign of a stroke for at least 12 hours. It turned out to be a complex migraine triggered by a caffeine overdose and sleep deprivation. I changed parts of my lifestyle, including monitoring my coffee intake, and haven't had another episode since. Story 24. I am a nurse working in a very rural hospital where patients often avoid the hospital at all costs. I've seen many cases, usually involving diabetic foot sores that almost always end in toe amputation. But my favorite story is about an elderly farmer who came in with chest pain that wouldn't go away, as he said. When we asked if he'd had the pain before, he said it had come and gone for years, but it usually went away after he grabbed his electric fence. Apparently, the first time he had the pain, he was standing near the electric fence on his farm and reached out to steady himself. He accidentally grabbed the fence, got shocked, and the pain stopped. So, whenever the pain returned, he just grabbed the fence again, and it made him feel better. He had literally been cardioverting himself for years. He was treated and sent on his way, but we still chuckle about it now and then because he was so nonchalant about the whole thing. Story 25. I am a lab scientist, and once I had a man come in at the end of the day with chest pain that had been bothering him all weekend. The emergency department doctor ordered a troponin blood test, which helps rule in or out heart attacks. If the result is above 0.03, we consider that a sign of a heart attack and act accordingly. This man's very first troponin came back at 21. For context, the highest we had ever seen before, that was 8. The man should have been gone long before he got to us, but somehow he pulled through. The hospital I work at is a small 25-bed rural critical care facility. No cardiologists, no cath lab, no bedside assays, just the bare basics, and yet somehow this guy survived. Story 26. I am an army medic. One night around 2 in the morning, a guy came into the aid station with his arm all wrapped up. When we took the wraps off, it looked necrotic. I asked what happened. The weekend before we went to the field, he had gotten his entire forearm tattooed. Then he spent the week wading through chest-deep swamps, thinking that if he kept his arm wrapped, he'd be fine. I told him, "Brother, no." There was also a time when a female lieutenant came in complaining of pain in her downtown area. When I checked, it was a severe infection. She hadn't changed her tampon in nearly a week. We had to carefully remove it. Story 27. Years ago, working as a nursing assistant on an oncology floor, we admitted a man who hadn't urinated for several days. His bladder was close to bursting, and his poor area was severely swollen and painful. But the most striking part was that he had untreated skin cancer on his nose for years. Over time, it became infected with MRSA and spread across his face. He had lost his nose, cheek, and one eye on one side of his face, and was beginning to lose the other eye. You could see part of his skull. I don't know why he left it untreated or how long it took to get that bad, but I will never forget the smell and texture of his decaying face. On the upside, we convinced him to have reconstructive surgery. He received a skin graft that covered his eye, nose, and cheek. So, if you ever meet a very grumpy man with only a mouth and one eye, know that's way better than the alternative. Story 28. I am a nurse, and once I had a diabetic patient in his early 40s who couldn't afford to fill his oil tank during winter. He had neuropathy in his feet, so he couldn't feel they were becoming frostbitten. He'd been wearing his winter boots all the time for warmth. One day, his sister checked on him after noticing his phone was turned off. She brought him in because he seemed off. The doctor asked me to take his boots off, and one of his toes came off with the boot. He ended up having a below-the-knee amputation on one leg and a transmetatarsal amputation on the other. He was on IV antibiotics for weeks. Story 29. I got my period, but it wouldn't stop. By week 3.5, I was feeling sick, nauseated, and lightheaded. So my boyfriend, now husband, drove me to a walk-in clinic. They saw me quickly, and the doctor took my blood pressure. He did it once, frowned, did it again, then called the nurse saying, "This blood pressure cuff must be broken. Let's take her to exam room 3. In the exam room, he checked my blood pressure again and said, "This can't be right." My husband asked what was happening. The doctor asked if I had fainted, and when my husband said no, he told the nurse, "Your blood pressure is so low, it's a miracle you're even conscious. We need to call an ambulance." I don't know if it was the blood loss or my twisted sense of humor, but I said, "Oh my God, it's like the movie Death Becomes Her," and started laughing. I refused the ambulance and insisted my husband drive me to the ER. The doctor asked which hospital, and I had to sign an AMA form. We went to the hospital, where they rushed a stretcher out, and I was taken in immediately because the walk-in doctor had called ahead. It turned out I had a ruptured cyst, and that was just the start of a long journey with PCOS that messed up my hormones and stopped my body from ending my period. There was a total disconnect between my brain and uterus. I was hours away from needing a blood transfusion. Doctors couldn't understand how I stayed awake or avoided a transfusion given the amount of blood loss. So far, I've been blessed to have 2 kids naturally, but I've also had 3 surgeries and a bout of stage 1 ovarian cancer, which was surgically removed. The cyst had grown around the tumor, so I guess it finally came in handy. The worst part is, you'd think I learned my lesson, but it happened again. It's like I go into denial. By the time I got cancer, I had kids, which pushed me to be more diligent. The scary part is that I had a late period that was heavier than usual, and that's what made me get checked out quickly. Had I waited, I doubt I'd be alive today. I am going in for tests next week because things have gotten wonky again. Fingers crossed it's nothing serious. Story 30. When I was training to be a nurse, I was paired with a play specialist for a few weeks. One day, a mom brought her little boy, around 4 or 5 years old, into A&E. The doctor asked us to entertain and distract him while he examined the boy. He was happy, chatty, and looked perfectly healthy from the shoulders up, but his belly looked like he was about to have a baby. It was huge. This shocked both me and the play specialist. We followed the boy through a series of tests. He was extremely brave, letting the doctors do what they needed. The mom said the swelling had been going on for 3 months. The boy had a tumor. Surgeons removed it, but after surgery, the poor kid was embarrassed because of saggy skin and stretch marks. He often plays on my mind, especially since I have a child of my own now. I hope he's doing okay. Story 31. I got really sick really fast but didn't realize it. I had stage 4 CNS-positive Burkitt's leukemia, which is very rare. Less than 100 people my age get that cancer each year in the USA. A little over a year ago, I was super sick, but had a doctor's appointment already scheduled. I went in feeling awful, sweaty, hot, lethargic, lightheaded, terrible heartburn, and barely able to breathe. My dad, who was driving me, had to wake me up and said, "Get up, we have a doctor's appointment. You better be sick." Neither of us realized just how bad things were. 2 weeks earlier, I had been fine, working on a construction job in South Carolina. At the appointment, I had blood work and an ultrasound of my chest. The doctor was stunned by the ultrasound photos. Then they saw my blood work and told me to go straight to the hospital. The ultrasound showed 7 tumors on my liver. The biggest was the size of a grapefruit, the second largest the size of a baseball. My blood work was completely off. They diagnosed me with cancer and said it was a miracle I was awake, walking, and even cracking jokes. Later, I learned Burkitt's cells can double in size every 1 to 2 days. The doctor wondered why I hadn't had symptoms from my massive tumors before, since I only came in for heartburn. Story 32. I am the imaging technician working with vascular patients and wounds. I once had a man whose foot was completely broken sideways at the ankle. He still had it wrapped from when he left the hospital. He used the stump to move around in his wheelchair, leaving little blood-stained marks on the floor. Another man with severe ankle and foot wounds stopped going to wound care. He was afraid to remove the dressings, even after his foot started to smell. By the time I saw him, his skin had begun to liquefy. Earlier in my career, I saw a man with necrotizing wounds on both legs that had eaten into the muscle in several places below the knee. When I asked how long they had looked like that, he said about 2 years. The next time I saw him, he had undergone bilateral above-knee amputations. Story 33. I am a psychiatrist and was called to a suburban ER to see a man who claimed he had horrible stomach cancer and needed to lose weight to get better. He insisted he had been diagnosed by a very prominent gastroenterologist with Barrett's stomach, which isn't even a real condition. I was called because his story was so bizarre and the staff didn't know how to handle him. He eventually revealed that he had shot himself in the leg a few days earlier and was waiting for gangrene to develop. He believed that having his leg amputated would help him lose enough weight to cure his cancer. I excused myself to tell the ER staff to examine his leg and to call the county psychiatric service as per protocol. I am not sure what happened to him, but that was an impressive example of a delusion. Story 34. I am an A&E, or emergency department doctor. A farmer in his 70s came in reluctantly with his wife after falling while wrangling a sheep 1 week earlier. He didn't want to be there and said he was forced to come by his wife, who was worried about him. On examination, he was pale, short of breath, and clearly in pain down the right side of his chest, though he tried hard not to show it. X-rays and blood tests revealed he had multiple broken ribs, a punctured lung, and significant internal bleeding into his chest, which had made him severely anemic. There's just something about farmers. Their stoicism often crosses the line into pure stubbornness. I had a junior orthopedic doctor and recently had a farmer walk into the department 2 weeks after a fall, complaining of pain. He had actually broken his hip, but decided to ignore it until the pain made it impossible to sleep or even sit comfortably. Story 35. I am a doctor, and even in Australia, where healthcare is free, I'd see several cases every week like this. The general population is often medically illiterate or willfully ignorant, especially when I was working in rural areas. There was a woman with a facial basal cell carcinoma, a common and easily treatable skin cancer in its early stages, that she refused to acknowledge until it had eroded half her face and caused a severe systemic infection that ultimately killed her. I could see into the back of her nose from the side. One eyeball was held in place only by muscle, and she had no cheek on that side. She genuinely looked like a zombie. I've also seen countless people in their 30s who couldn't feel either of their feet due to permanent nerve damage from uncontrolled type 1 diabetes. It's a tough conversation when they ask, "Can't you just fix them so I can go back to work?" Just last week, a previously very healthy man in his 60s came in with chest pain, breathlessness, and near-fainting episodes for several days. He arrived at the emergency department after collapsing with a cold right leg. His heart damage markers were through the roof. He was rushed straight to surgery for coronary artery stenting. He had 100% blockage of the left anterior descending artery, severe cardiogenic shock, and because his heart wasn't pumping properly, a huge clot in the left ventricle was sending off mini clots that cut off blood supply to half of his organs, including an entire leg. The poor man had cycled 200 kilometers the week before. Story 36. I am a final-term medical student, and during part of our surgical rotation, we were assigned student-friendly patients from the emergency room cases that were somewhat suitable for us to see. One day, I saw an elderly man who came in complaining about a lump in his groin. He told me it had been bothering him for a couple of months, especially when putting on his pants, but he hadn't told his wife or anyone else about it. When I examined him, I immediately knew it wasn't a hernia as originally suspected. Instead, it was a large tumor with several lymph nodes involved, around 5 swollen nodes. It was eventually diagnosed as T-cell lymphoma. I don't know what happened to him afterward, since as students we don't usually follow patients long-term. But what stuck with me most was that he had come straight from work wearing his ID badge. He looked like a completely different person, like a husk of himself. His face was so skinny, it was heartbreaking. Story 37. I am a nurse, and ironically, I became one of those "why didn't you come in sooner" patients. It started with a sore throat. I didn't think much of it. My daughter had just come home from school with strep a few days earlier. Then I spiked a fever, but I just let it ride. My head started pounding, and my neck got stiff. That's when the thought hit me. Oh crap, do I have meningitis? The fever climbed all the way up to 104, so I called my own doctor and explained the symptoms. Their advice? Basically, wait until tomorrow morning. I thought, okay, fine, I will take some Advil and try to tough it out. But that night, the fever just kept rising way higher. I honestly don't remember much after that, except my ex-husband demanding I call the doctor again with my temperature, which was now over 105. The response was still the same: write it out at home. In my fever-fogged brain, I thought, yeah, okay. Thank goodness, my ex finally got fed up, and a fireman literally carried me to the car and rushed me to the hospital where I had just finished my ER internship. My temperature was still over 106, and my heart rate was dangerously high. What struck me most was the shock on the triage nurse's face when they saw my vitals. They gave me the highest priority because, honestly, this was life-threatening. And then came the looks, nurses and techs shaking their heads, clearly thinking, "You're one of us. How did you wait this long?" Here's the truth. Nurses don't seek care for themselves, and try having common sense when your brain is cooked by 106-degree fever. Story 38. For months, my friend had these sharp, stabbing stomach pains. She just ignored them. She wasn't eating real food anymore. Anything she ate just came right back up, so she survived on popsicles for months. One day, she went to a fair with her sister and her 3 nieces. As they were walking from the parking lot, she twisted her ankle. She was in pain, but she just kept pushing through it. She went to work the next day, and the next, but a week later, her foot was swollen so badly she could barely stand. She works retail, so standing is everything. Her manager finally told her she had to leave and get to a hospital. After bouncing between several hospitals, they started looking at heart or kidney problems. The truth hit hard. Her kidneys had completely failed. They couldn't even see them on the scans anymore. Now she's on dialysis and waiting for a kidney transplant. But here's the thing, I still have my best friend. These days, she's the one telling me when I need to go to the hospital. She's been a constant source of support when I was sick with COVID earlier this year. It's a reminder that even through the hardest battles, friendship and strength can pull you through. Story 39. My grandparents lived in a remote corner of Washington State, about an hour from the nearest small-town hospital. Grandpa had been battling bladder cancer and was dependent on pain medication during his recovery. Grandma and my aunt did everything they could to care for him at home. They spoke to the doctor about his increasing need for pain meds, so they tapered him off. But after a few weeks, Grandpa started asking for more pills again. The complaints grew louder and more persistent. Grandma thought he was just trying to get more drugs and said no for a month or 2. Eventually, they brought him back to the hospital, and that's when they learned the cancer had come back aggressively. Yes, he had developed a dependence on the medication, but more importantly, he had been living in agonizing pain the entire time. By then, there was nothing left to be done. Grandpa passed away quickly. The family was overwhelmed with grief. No one blamed Grandma or my aunt. They had done their best under difficult circumstances, but the guilt they felt was heavy, and some resentment lingered beneath the surface. Since Grandpa's funeral, the family has struggled to heal and come together again. Story 40. I once cared for a 65-year-old man diagnosed with lymphoma about 8 months prior to our first encounter. He lived an hour outside the city in a remote area and decided against traveling for treatment, choosing instead to stay isolated in his rural home. Without treatment, the lymphoma aggressively spread across his skin, eventually covering the area from his head down to his knees. When his neighbors finally checked on him and called an ambulance, his condition was dire. The disease had invaded his eyes and mucous membranes, leaving him barely able to see or drink. His skin began to slough off, and he was losing so much fluid through these open wounds that we had to manage him like a severe burn patient, requiring plastic surgery consultation and intensive care. The consultant remarked that had he received treatment earlier, there was a chance for recovery. Unfortunately, the delay proved fatal, and he passed away just 3 weeks after admission. Story 41. It was around 1 a.m. when I started having absolutely crippling stomach pains. The pain was so intense, it quickly spread to my back, chest, and upper arms. But because I'd suffered panic attacks for years and had been to the hospital multiple times for what turned out to be nothing, I fought the pain, convincing myself it was just GERD or IBS flaring up, made worse by my mind. 4 hours later, still in agony, I finally called an Uber and went to the hospital. The triage nurse took one look at me, asked if I had chest pain, and immediately took me back for an EKG. Moments after the test started, they rushed me into surgery. I was screaming, convinced I wasn't going to live. 7 hours later, I woke up in the cardiac ICU after having 2 stents placed in my heart. The doctors told me I'd suffered a Widowmaker heart attack and weren't sure how I survived waiting so long to seek help. The irony is that the first time I actually didn't think I was having a heart attack was during the heart attack itself. At 39 years old, I never thought it could happen to me. Even with my family history, especially since my mom passed away suddenly from a heart attack at 58. Story 42. I am just a student shadowing during the pandemic, and I saw firsthand how fear of the virus impacted people's health decisions. One guy with a known history of heart problems had a classic heart attack and then developed symptoms of heart failure, symptoms he recognized because he'd experienced them before. Still, he waited several days to come to the hospital because he was worried about catching COVID. Eventually, the fluid buildup in his lungs made it impossible to breathe, and only then did he seek emergency care. He was immediately hospitalized. My professor also told me about a recent patient with an aortic aneurysm who was misdiagnosed after only having a telehealth visit during the pandemic. Without imaging, the outside hospital missed the diagnosis, and she ended up with an aortic dissection. Thankfully, she sought a second opinion at our institution and received the proper care. The COVID-19 pandemic has not only harmed those who caught the virus, but also people who delayed or avoided necessary medical treatment out of fear. It's a stark reminder that even in a crisis, we must encourage people to seek timely care for urgent health issues. Story 43. I was an EMS supervisor and once responded to a call involving a patient with classic stroke symptoms, sudden onset one-sided paralysis. She was still able to talk, but insisted she neither needed nor wanted to go to the hospital. The paramedics were in a tough spot, balancing respect for her wishes with the urgent need for care, so they called me in. I spoke with her and ran into the same problem. She denied the severity of her condition. To assess her awareness, I touched her unaffected leg and asked if she could feel it. She said yes. Then I touched the paralyzed leg and asked if she could feel that. She said yes. Then I touched the paralyzed leg and asked if she could feel that. She said no. When I asked why, she replied, "That's not my leg." That statement told me everything I needed to know. Her mental state was impaired to the point that she couldn't make informed decisions about her own care. I authorized the paramedics to transport her, instructing them to document her impaired judgment as justification. Once we began loading her into the ambulance, she offered no resistance, which I expected. I never got an update on her outcome, but I never faced repercussions for the decision. Story 44. I was this patient a few years ago. I had a boil on my butt that as Mr. Tough Guy, I thought I could just walk off. Turns out I couldn't. The pain became unbearable. I couldn't sit or stand comfortably. And in the worst moments, I was either limping painfully or lying down in some awkward position just to find relief. I waited over 2 weeks before finally giving in and going to the ER to get it drained. When I told the doctors I'd tried to handle it myself with Epsom salt baths and wishful thinking, they weren't exactly thrilled. I ended up with a staph infection and a very upset doctor who made it clear I had brought this on myself. Story 45. I am a PA working in orthopedics, specifically hand surgery. One day, a patient came in saying he'd had a wrist replacement several years ago and mentioned he had a hole in his wrist. I assumed it was just a small draining sinus, which can happen occasionally. When I reviewed his x-rays, I saw he had a significant contracture, not ideal, but not unheard of. Then I removed the Coban wrap from his wrist, only to discover a 3 by 6 centimeter hole directly exposing his implanted wrist replacement. The hole opened right onto the polyethylene insert that allows the implant's components to glide smoothly. He told me he'd first noticed the hole about 4 years ago and only sought medical help when it grew that large. Story 46. I am a dentist, and during my hospital residency on call, I saw a patient who came in saying, "My tooth has been hurting for a couple of months. My face started swelling a few days ago. Last night, it became hard to swallow, and now I am having trouble breathing." He was diagnosed with Ludwig's angina, a rapidly spreading, life-threatening infection of the floor of the mouth. Due to severe swelling, he couldn't be intubated and required an emergency tracheostomy when he stopped breathing and his oxygen saturation plummeted. He spent 2 weeks on IV antibiotics and was hospitalized for 4 weeks. This was all because of a dental infection. It's important to note that dental insurance often isn't true insurance. It's usually a discount program or an employer benefit. In this case, the patient had state medical and dental coverage that covered exams, fillings, and extractions at no cost to him. Yet he still delayed care until it became a critical emergency. I worked extensively with Medicaid patients in charity cases during residency, so I am acutely aware of the challenges surrounding dental care costs and access. The blame lies with insurance policies and systemic barriers, not the dentists who do their best to help. Thank you for watching. If you enjoyed this video, be sure to give it a thumbs up, subscribe, and hit the bell icon so you never miss an update.